So welcome back to another edition of the Heart to Heart podcast. And my guest today is Dr. Suneel Dhand. So Dr. Dhand is a physician. He's working out of Massachusetts right now as an internal medicine specialist, but grew up in the UK. So Dr. Dhand, welcome to the show.
Thank you. It is a pleasure to be on your show.
Well, I'm very, very happy that we're chatting today. And there's a lot of different reasons why I wanted to have you on my podcast. But certainly I kind of connected with you on Twitter because of your stance on COVID. So, maybe we'll start there. There's been several, landmark studies that have come out, recently. There's the one on mass, one on natural immunity. I'm not sure where you want to start. Like, which one do you think is the most important, or the one that kind of caught you off guard the most?
Well, yeah, you've alluded to a few great points there. I think almost every single thing which our authorities were classing as misinformation has ended up as information now. And what many of our authorities were saying turns out to be the misinformation. So it's highly interesting that we're having this kind of mass awakening with time as the fog of COVID subsides. I have so many issues with what the authorities were saying right from the very beginning. I did not think from March of 2020 that we were following a logical or rational approach. I had suspicions about different motivations that were involved. I would say that the number one issue that affected me personally was the issue of natural immunity to COVID-19. And I found myself as a physician. My main practice is internal medicine in the hospital. I also do some outpatient work in the lifestyle medicine, metabolic health arena, which is my main passion. But as a doctor who was working at the front lines of COVID since the very beginning, treating hundreds of patients in different hospitals, I even went to New York to the epicenter of COVID-19 to help there. And I contracted COVID-19 very early on. And I knew that I had had COVID. Thankfully, it was a very mild case, and it was before we even knew that COVID was among us. And I knew that I was naturally immune to COVID-19. I was checking my own antibodies, and lo and behold, a year and 3-4 months later, I found myself in a position where I was being coerced into taking a vaccine that I didn't need. And the whole time, I was talking a lot for several months about natural immunity to COVID-19. It was being ignored. I was getting more and more frustrated, and then unbelievably found myself in a position where I was faced with the possibility of losing my job, having to move state, even having to move country over this issue. Thankfully, common sense prevailed in the end, but I will neither forgive nor forget what the authorities were doing when we already knew at that point that natural immunity to COVID-19 was a very big thing. And this is not an argument against vaccinations. It is an argument against our authorities who are ignoring the very basic fundamental of evolutionary biology, which is natural immunity. So that's where I stand, and we can certainly discuss any specifics from there.
Okay, well, I can't believe that you had to go through all that, but maybe I shouldn't say I can't believe it, because I know a lot of other physicians had, but it's terrible that you guys had to, and you shouldn't have had to go through that just for raising some concerns, or not even raising concerns, just pointing out that, natural immunity is also beneficial in providing protection against severe disease, and also against reinfection. And so, I mean, when you saw that study then that came out recently, and for people who don't know what I'm talking about, there was a study that came out in the Lancet. It was a meta-analysis. I think there was 65 different studies pulled together in 19 different countries. So, quite a good, robust method there. And what they found, in that study was that natural immunity was actually better than 2 doses of the vaccine. And I had posted this originally without the graphs, but if you look at the graphs in that study, as I'm sure you did, it showed that it was not just a little bit better, but it was substantially better, and not just against one variant, but across all variants. So the fact that we didn't take into account natural immunity when we were providing vaccinations to others, It was terrible. It was unscientific, and we've done a disservice to a lot of those people who may have not needed to get vaccinated. Just like yourself, I am not against the vaccine. I think that the vaccine was a very valuable tool, at least initially, in the pandemic. But now, I think that because the reason that we're doing well is not necessarily because of the vaccine, but it's probably more so due to the fact that people have natural immunity. Again, I'm not saying that the vaccine has nothing to do with why for the most part COVID's been controlled pretty well for the last few months, almost even to the last year. It's been much better controlled. Hospitals aren't as overridden with patients anymore. And I think, again, a lot of that is from the natural immunity component as opposed to the vaccine. So in your account, how many people do you believe may have been vaccinated unnecessarily, that may have not required the vaccination due to the fact that they had natural immunity?
I really believe that those numbers could be in the millions,
Yeah.
when you take into account people all over the world. And it was inexcusable. And you correctly cited that recent study there, the Lancet study, which was very comprehensive. But there were studies coming out since the end of 2020, beginning of 2021, showing the durability of natural immunity. And even Dr. Fauci, Saint Fauci himself, said this before the pandemic, and then flip-flopped, as he's flip-flopped on so many other issues, that
Yes.
the reality is that natural immunity, post-infection immunity, is nature's best vaccine. And everybody knows this. Everybody who came through medical school, at least who came through medical school pre-wokeism and actually learned real medicine and science, knows that. That is common sense. And I got COVID-19 through no fault of my own. It was February 2020, and I was very suspicious that it was COVID based on some symptoms I was having. Recovered quickly and knew from my antibody test that I was protected, and the logic just wasn't there for me.
No,
I had a
just one
mild
question
case.
on that,
Yeah,
if it's okay. How did you know you were positive in the first place, or were you just kind of assuming based upon what was going on, or did you have a positive COVID test?
I actually have never had a positive COVID test. So what happened
Okay.
was, I contracted COVID before we knew it was fully among us. It was on the
Okay.
news that was spreading. I live in
Yeah.
a big metropolitan area in the US. I regularly travel to New York City. I am rarely ever sick. So what happened was, I just started to feel feverish. I thought something is wrong. I took a day off work. That was it. And then went back to work, not knowing. I thought I just had the flu. And then for about 2 weeks afterwards, I had this lingering dry cough. And it was very, I mean, it was mild, but I wasn't bringing anything up. And then I was hearing all the information that the number one sign is it's a dry cough. You don't bring up phlegm generally with COVID. And I thought, it's strange. I don't usually get sick. I had to take a day off work, wasn't feeling good. Now I've got this dry cough. Let me check my antibodies, which I did at the beginning of April, and they're sky high. And other people around me were testing, and they were not high. And I knew then that it was COVID-19. And my logic and reasoning was, well, I had a very mild infection in the first place. What will the vaccine in the future protect me against? Because they're
Yes.
already saying the idea of the vaccine is to prevent severe infection. And there's no evidence that, knock on wood, somebody who's metabolically healthy, who has a mild infection, the next time it would be worse. If anything, it will be even more mild.
I was gonna say,
And
as like,
yeah,
in addition to having natural immunity, you also too, appear to be pretty young and healthy. So, based upon that, you have to take that into consideration as well. So when I was, asking you earlier, how many people do you think were, vaccinated unnecessarily? Yes, natural immunity is something that you have to take into account, but also take into account the person's age and the person's health status or vitamin D status, and all those things
exactly.
with yourself appear to be optimized. But go ahead with the rest of the story.
Yeah, so millions of people were probably in a similar circumstance to me. We were already dealing with a virus which had spread like wildfire before all of the full contagion. I mean, the social media and mainstream media contagion set in, and then we went into a lockdown. We panicked, but the data wasn't there for going as far as we did. And okay, we waited months. The vaccine came out, and the whole time I was working at the front lines, seeing COVID-19 patients, and hadn't been infected. And when rumors started to circulate, this is around May of 2021, that this thing is going to be mandated, I took a very strong stance at that point, because for me, it was an ethical issue. Here I am as a doctor. Like you, my interest is metabolic health. The notion that I wouldn't take a medicine if I thought it would benefit me is nonsense. Of course I would take it. I value my health. I really care what I put into my body. I'd do anything to improve my chances. But I knew, for me personally, that the risks were not going to outweigh the benefits. And I took it very seriously indeed, that here is my government putting me in an impossible position, and they're basically coercing me into a medical therapeutic that I'm 110% confident I don't need. And all these people who are throwing around terms like hybrid immunity, who's ever heard of that term before? It's like one of the many made up terms since the pandemic started, like breakthrough infection, mild myocarditis, all these other terms that we use that none of us had ever heard before. But okay, maybe there is a phenomenon of hybrid immunity in someone who's at risk. You add a level of immunity to them from a vaccine. But I was 110% convinced that this thing, which after all is a novel therapy, it uses a novel way of working, it has a genetic means of working through mRNA. I'm not going to take it. It's not going to benefit me. And I will not let my government put me in a position where they're forcing a medical therapeutic on me that I know I don't need. Plus, I'm a doctor that's been working at the front lines the whole time. The whole thing made no sense. And I made it very clear that I would rather quit. I'd move somewhere else than be in a position to have this forced on me. A couple of places, actually, ironically, in New York, would not let me work there. So I ended my relationship with those hospitals. But thankfully, where I did work, I was able to work out a common sense solution to this, a workaround. But yeah, it just was unnecessary. And those of us who actually read the studies from the beginning knew how this was going to pan out, that this vaccine was non-sterilizing, it was going to come with risks, and it's a coronavirus. It's going to keep circulating and mutating, and the vaccine may or may not help lower your chances, but it's not a magic bullet, certainly not enough to warrant a mandate. So these mandates, completely ethical, a complete ethical red line for me. And I am shocked and disgusted that more authorities in the United States didn't stand up. Maybe I shouldn't be so shocked, because we know the reality of how organizations and institutions are bought out. But I was actually proud of the United Kingdom. I cannot speak for your country, Canada, but I know in the UK, many royal colleges came out and said, you can encourage this thing, but you cannot mandate it. It's unethical. And as a result, they didn't have any mandates in the end, anywhere in the country. There were no mandates. There were no restaurant certificates. They talked about it, but they never went through with it. And that actually made me very proud of my home country, the United Kingdom.
Yeah, unfortunately, Canada was not the same as United Kingdom. We had a lot of restrictions, a lot of lockdowns, a lot of business closures, a lot of, people who lost their business and are, haven't been able to recover or are trying to recover now. So, I wish we had followed suit with you guys, but unfortunately we didn't. There's only a few places I think in the world that were as locked down as much as Canada and Ontario specifically, where I am. So I'm in London, which is about 2 hours from Toronto. Our area specifically was really locked down. We had very, severe mandates. There's plenty of times where you had to show your vax pass to get into a restaurant, get on an airplane, all that kind of stuff. So I really wish we had gone a different route, but we didn't. That being said, you said a couple very interesting things that I want to ask you about. So coronaviruses in general. So for people who are not aware, there's actually 7 coronaviruses that we identified from my understanding. 4 of them are common upper respiratory tract infections that have been circulating prior to COVID. Then we have SARS-CoV-1, which came on the scene around early 2000s. We had that SARS scare. And then there's MERS, which is basically a very severe disease, but it's been isolated so much. I think there's only been a few thousand people that have been infected total in the world ever. And then the last, of course, is SARS-CoV-2 or COVID, or what we have now. And I remember looking early on at some of the studies that you were talking about, Dr. Dhand, and I'm sure that I wish I could remember exactly them now, the authors of the papers and that kind of thing. But it looked early on, like through a lot of those studies, that natural immunity was in fact protective and very long lasting as well. And from my understanding, people were saying that if you had SARS-CoV-1, you would have protection against SARS-CoV-2, again, COVID-19, what we're talking about now. And I mean, we're talking about like a 20-year span there that is still providing some protection. So I was just wondering, if you could speak to maybe some of the specific studies on immunity that you saw early on that showed that having COVID and recovering and having natural immunity does provide very robust protection against reinfection and severe disease.
Yeah, so these studies started to come out. The first ones I saw actually were 2021. Some from the Middle East, Israel, Qatar, were showing this phenomenon was clearly present. A lot of the studies in the United States were looking at healthcare workers who were all exposed. There was one in the Midwest. I can share this citation with you afterwards. It was either in Ohio, Minnesota, which showed quite clearly that people who had already been infected were not going on to get severe infections again. And it was astonishing to me that our health authority in the United States, the CDC, was not going with this data. They were cherry picking their own data. Notoriously, in the summer of 2021, they pulled out some Yahoo study and managed to cherry pick some data from Kentucky, I believe, which showed the opposite, that natural immunity plus vaccination worked. And it was the worst piece of data collection and manipulation that you can imagine, but we've seen worse since then. But prior to that, there was already data. And I mean, let's think about the simple fact, even with the initial strain, the Wuhan strain, how many people were asymptomatic? When I had it, for instance, I was around people when I started to feel unwell. There were no masks. Not everybody around me got sick. So clearly some people already had a level of immunity to it. It was not like the plague spreading rapidly, infecting everyone who came into contact with it. The fact that it was asymptomatic should have told us two things from the very beginning, that lots of people were already immune to it. And secondly, it's impossible to contain a virus with a high asymptomatic rate unless you test every single person every day.
Yes, I just can't believe we did so much, testing. And, still today, actually, it's kind of ironic that we're talking about this, because I think they just stopped some of the rapid home kits today. But yeah, the over testing, I think, really contributed to the pandemic itself. I think that if we had, maybe had not as required people to test as much, we may not have had such of this real big stress response that we had, particularly in Canada. And it's crazy how many times some people tested themselves. I'm certainly not against testing. I think that is something that we do need to do, but it didn't need to be done for every single person, especially when you're not asymptomatic. And I'm not sure where they grab the data on testing asymptomatic people all the time. But we know that asymptomatic spread is very, very low. So again, it's just another point where where is the science in mass testing people for asymptomatic spread? I'm not really sure, but that was definitely a very, very confusing point that I think a lot of people were frustrated with.
Exactly. Yes. I mean, a couple of points there with the asymptomatic testing. Firstly, I do believe that we are victims of our own circumstance. At no point in history up until relatively recently would we have the resources to do that. Do you think in Africa, Asia, India, they have the resources to test like we did? Absolutely not. There's no way. Whatever we think the COVID rates were over there, they were 10 times more than we think, because people simply didn't test. Who's going to test with an expensive test for minor symptoms? But we had the resources. And I also believe that you shouldn't forget the influence of the major players here who are making a ton of money from testing, who had lucrative government contracts. A lot of roads lead to money. I know you believe this too. Follow the money.
Absolutely.
And when all is said and done, this will be looked into, and we should absolutely look into the relationships of every single person who made money from tests with major government players who signed off on these tests.
Who did benefit the most from tests? Do you care to get specific about that?
Well, the companies first and foremost benefited, but this has been uncovered in the UK already. A lot of the companies who got lucrative government contracts for testing had relationships with members of parliament. Some of the members of parliament themselves had financial links to these companies. So, of course, if you have a situation where you can sign off on something which is going to generate a ton of money for yourself as well, you're going to do that. And when people are afraid and mainstream media is perpetuating this sense of fear, you must get tested, people are going to say, well, this is a good idea. These tests are available. I mean, when I look back and think what we went through, I mean, we're all going to end up writing books on this one day, or at the very least telling our grandchildren. But I remember I could travel back and forth still, thankfully, because I'm also a US citizen. If I was not, I wouldn't be allowed back into the country, but US citizens didn't need to be vaccinated to enter back into their own country. So I would go back to the UK, and the UK had a more intense lockdown actually than the US, which they're now suffering the financial consequences. But when they were locked down, anyone who visited the country had to go on the government website, register. You had to buy tests, which would be sent to your house. And before you leave, you get tested. When you're there, you have 3 tests, which you have to mail back. And then coming back, obviously, you had to test again before you board a plane. So I was in a situation where I would go back to visit family for maybe 10 days, 14 days. And in that time frame, I'd have 5 or 6 COVID tests. I mean, what the heck? And I had no symptoms the whole time. And I was having to do this. Somebody somewhere was making a ton of money. I'm thinking Heathrow Airport, they had entire sections dedicated to COVID testing, and you would have to pay £30, whatever that is, $50 for this test to be done, which is like a 2-second test. And it made no sense. You're feeling completely fine. Why are you testing for it? And you had a negative test 2 days ago. What are you trying to find here?
Yeah, that doesn't make any sense, and I'm very interested in following the money and in finding out who did profit from all these people who were tested when they didn't have any symptoms. I mean, it's kind of crazy to think, just because, like you said, we don't do that in other areas of medicine.
We don't. No, I mean, look at the resources expended. I would get text messages when I was to the UK. Believe it or not, I kid you not, at least 3 visits I went back, they had representatives of the National Health Service come to our house to check that I was at home and isolating for, initially it was a 10-day requirement, and I'm feeling fine. And this is a system which, if you get diagnosed with potential cancer, won't even see you for 3 months. Where did those resources come from to focus so heavily on a virus which is asymptomatic in most people and half the people have already had? Makes no sense.
Yeah, I mean, I had something probably, I guess, not quite as bad as that, but when I went away in 2020 in December, which was kind of unheard of, but myself, my fiance went away at that time, and when we came back, we had to quarantine, and unfortunately, then we got back on the 14th, and there was 2 weeks quarantine, so we couldn't see her her family over
Oh,
Christmas
goodness.
because of that, right? So we kind of knew that going into it, and we knew we were going to have a few days afterwards before New Year's. So we thought, you know what, let's just go anyway. But still, I just think it was completely unnecessary. You know, there was basically a full Christmas where we, you know, didn't get to spend Christmas days with, you know, my fiance's family, which is obviously a little bit, you know, disappointing. So I think a lot, and that's just one story. You have your story, but there's a million other stories out
Oh,
there
of
where,
course,
you know,
yes.
people have, you know, not been able to see. The bigger one is not being able to see your loved ones in the hospital when they're dying,
Absolutely. I
like
was going to
not being
touch
able to
on that.
see.
People who lost their relatives. It's
Yeah,
my heart breaks for these people being put through that for no reason. I mean, imagine knowing your loved one died alone and you weren't even allowed in with an N95 on. It makes no sense.
yeah, that I think is probably the worst thing about that kind of situation. One thing that I wanted to ask you about today, because it's such a hot topic, and believe this from the beginning, because again, it made the most sense to me by far. So I guess we can't say the lab leak has been confirmed, but I mean, we're talking about, Dr. Marty McCara, Dr. Jay Bhattacharya, like the best, doctors in the world, essentially, and saying that, this is definitely where it came from. The FBI has come out and said that's where, they think it's come from. So, basically, it's almost a general consensus now that this is where the virus came from. Is this a surprise to you? Did you think this from the beginning, Sunil, or what are your thoughts on the lab leak?
It's not a surprise to me now. I must say, when this first happened, COVID started to dominate the news. I did fall into the general mode of thinking that this was from a wet market. And I actually remember posting online the horrific conditions in these wet markets, which are awful. I mean, they wouldn't be allowed in Western countries, and conditions are rife for disease to spread. So I made that point. But within 4 or 5 months, I seriously started to question that, because I was talking to a lot of smart people who were telling me that there were very suspicious sequences in this virus that didn't look natural, and then the Wuhan Institute of Virology right there. And I would say that the clincher was, funnily enough, when I was working in New York, primarily taking care of COVID patients, I was taking care of a patient whose relative came in, and she was actually a virologist, and she ran her own lab, and we were talking, and then she started talking about what she was doing and said, I can't remember what part of the country she was from, far away, or she may have even been coming in from overseas, but either way, she was an expert, and she said, look, I have to tell you something. Do you realize that this was a man-made virus? And I said, well, I've heard people say that. And she said, no, take it from me, I'm an expert. We all knew in our community, I was getting emails that this was not natural. The way it spreads is not like a natural virus. There's an HIV sequence in there. It totally is man-made. And she looked me in the eye and said that. And when she said that to me, because she was so trustworthy otherwise and such an expert, I said, boy, wow, you are probably onto something here. And this is like a year and a half ago. So no, in answer to your question, the story does not surprise me at all. I think there was a mass cover up. I think Dr. Fauci, we're only just beginning to realize how far deep he was into this mess. And I haven't thought highly of Fauci for a long time. But could you imagine? I mean, let's just say, I mean, again, I won't assume anything. Here you have this person who's basically leading the COVID pandemic response and is coming out speaking to millions every day. Can you imagine you're a doctor too, ethically knowing in the back of his head that he could have played a role in this actually starting in the first place? I mean, he didn't release the virus, but if this gain of function, all of these whispers are true, and let's be realistic, how many whispers have we had that end up being true? So wouldn't surprise me at all if we find out he was knee deep in this and was deliberately trying to cover it up and basically ban any talk of it. Only a year ago, if you look on Wikipedia, lab leak was classed as a conspiracy theory. You were banned on social media. I mean, this is astonishing. I wish I could say the world has learned lessons from it. I'm not sure they have. The people
Yeah.
who censored, whether they realize what they did and what a terrible, terrible thing happened, and the level of dishonesty and corruption that was potentially involved, and how they played a part in censoring a true story. It's horrible.
Yeah, I think there's kind of like two parts to that. I think one is that some of it is just general like willful blindness. People know it's there and they, just don't want to look that way at all. And then the other part is people just don't want to admit that they were wrong, or they don't want to admit that they were kind of duped, and I think that's a reason why some people, it's so strange, but like they're still holding on to like this hardcore narrative. And even like doctors,
Oh
and
yes,
and
well, some
people
of the worst. Yeah.
we have this group in Canada, Science Up First, and like they just keep on telling everyone to get vaccinated, that the Cochrane review was a bad study and that everyone should mask up. Like, it is crazy. And they're supposed to be a group that's battling misinformation. Meanwhile, they're putting
Yeah.
out a ton of misinformation. Yeah, I mean, and this guy, David Fistman, we have in Canada, I mean, he's the same way. He just keeps, harping on the Cochrane study. And for people who aren't aware, the Cochrane reviews have long been considered to be gold standard for, evaluating evidence. I'm not saying they're perfect, but they are considered to be the gold standard. And there was a review that came out just about a month ago, maybe a little bit more now, maybe a month and a half, that indicated that basically universal masking is ineffective, but they don't have the evidence to recommend it, at least. And it's ironic too, because I always bring this up, is that there was also a Cochrane review done on masking in 2020, just for general viruses, for general respiratory viruses, I should say. And they had the exact same conclusions. And then we also have, the Bangladesh study and the Denmark study that, basically said that, masks are largely ineffective overall. So, when you're pulling, and then also to the mask mandates, if you look at the graphs, like, across the states and across various different places, it
Yeah.
looks like they made no difference. So like all of the data, points to one thing, yet somehow there's people out there, again, some of them are even doctors, and they're saying that, everyone should still be masking. And so it's like, when you said earlier, that, it's a lesson for the world, and I think the lesson we'll learn, but I'm really not sure. I'm not sure either. It's kind of crazy that we have all this data, yet people still won't, put their ego away and just admit that they were wrong, and then just move on and approve, the current science or the best evidence. And I'm sure that you've seen that a lot, where you are too, in Massachusetts and abroad.
I have, yes, yeah, absolutely, and it touches on many bad streaks within our own profession of not wanting to admit you're wrong, wanting to be authoritarian, wanting power, wanting to control people. These things go back hundreds of years. There's a lot of factors involved, I believe, in the psychology of certain doctors who have embraced this like a religion. And I'm so glad you mentioned the Cochrane review. For anyone listening, please look up Archie Cochrane, because I went to the University of Wales in Cardiff, and I spent countless hours in the original Cochrane library, which is where he did his work. And he was an expert on communicable diseases. He was a complete medical hero, and he would turn in his grave if he saw what medicine has become today and what some physicians advocate for in the face of evidence to the contrary. It makes no sense at all. And I don't think, because obviously we think alike, Michael, on many different issues, but
Many
I
different
don't think
issues.
you can draw an equivalence between people like us and people on the other side, because we're very different. So people like us are saying, well, there's some doubt over whether vaccines are useful or not in this circumstance. There's some doubt over whether masks work. So let people decide. Let people make their own choices. Seems very reasonable. They're very different, and this is why they're so dangerous, and we must stand up and fight against them. They say, no, we are right, and you have to do this. There's no choice. If they could, you have to take the vaccine. You have to wear a mask. We are the authoritarians. They're not about choice. They're not about reason or being rational. So as far as I'm concerned, we are not equivalent sides of the debate. They are completely unreasonable, and they're very bad elements in our profession and the whole field of science that go back a long, long time, which is why doctors and scientists have done some atrocious things if you read the history books. And it takes people like us to really take a stand, whether it's for vaccine ethics, whether it's for saying, no, you're wrong on masks. We have to keep pushing back, because if we don't, they win. And
I
sadly, they
agree.
occupy a lot of the top positions in medicine and science right now. Academia, I mean, you will get few, I tweeted about this the other day, you will get fewer more corrupt arenas than academic medicine. That's not to say your average academic is corrupt and giving bribes. It's the way the whole system works, the way things are funded. It's all based on money, corruption, and business interests. Many doctors don't even realize that they're a silent party to it. They're being used.
Yeah, I agree 1,000%. I think that, sometimes physicians don't realize, the position that they're being put in, and then they kind of just go along with the narrative because they don't want to ruffle too many feathers. And I've been told, so many times, like, why are you speaking out against COVID? You're just gonna get in trouble, and it's gonna look bad for you and your image and this kind of thing. And I always just think, like, if everyone thought that, then nobody would be saying anything, and we'd all just be obeying everything and following orders. So, I feel like it's almost like my duty. Like, I have to, step up and say something, because if there weren't people like yourself and like Dr. Marty Makary and Jay Bhattacharya and Martin Koldorf and all these people who have stood up, then nobody would know these things. People would still be in the dark. So for the people who have, seen the light and they know the truth, you have to come out and speak the truth, because if you don't speak the truth, then obviously, all that darkness and all that corruption is just going to prevail. So, that's why we need to have conversations like this. And that's, why I wanted to chat with you today and have you on my podcast, because we need to spread this message, around the world. And I think that in many ways, it is being done. I mean, the studies that have come out recently, like we've talked about, have really shown that, all of the public health measures were, basically all for nothing for the most part, and that we received really, really poor advice. So, we do need people to, stand up. So, I'm so thankful for people like yourself who are willing to, come on and say these things, because, we need more of that in medicine. And it's unfortunate, like you said, that there's so much corruption in medicine, and that's the reason why there's there's not so many physicians that are speaking out. But like I said, that number, I think, is definitely growing. Like, do you think it's growing from what you've seen?
I do believe it's slowly growing. More are speaking out, but I'm still very disappointed, and I won't forget that so few spoke up, because
I
it's
agree.
always true.
Yeah.
If you look at any world event, people get braver afterwards when there's not that level of fear. But actually, your duty, and I think the duty of a physician, because I take my oath seriously, I'm sure you do too, one of the core principles of being a good ethical physician is, when you see something, say it.
Yeah.
Whether it's a vaccine side effect, whether it's something obviously not working, whether it's a phenomenon that seems unusual and counter to the narrative, it's your duty to speak up, be brave. And so few doctors did it. Okay, a few more are now, but I think if nothing else, even if no doctors did it, people are not stupid. I mean, what's that phrase? You can fool someone once, twice, but not three times. Look at the vaccine uptake rates. They're abysmal. 96% of appointments in the UK for COVID vaccines are not taken up. Every other person says to me, I'm not getting it. I don't believe the authorities. And then you have the clowns at the CDC who are doubling down, saying, you must get it, not realizing that they become parodies of themselves. People are laughing at them, but
Yeah.
they are just either so walled off or so soaked in their own corruption, they can't see it. But especially in a time like today with social media, if nothing else, even if every doctor, even if I followed the narrative, I still think the general public is not stupid, and they would cotton on after a bit and push back, with or
Yeah. I
without us.
I think so too, and I'm very glad, too, that there are other people speaking out, and certainly when you have an MD behind your name, it gives you a little bit more validity when you speak out. But there's been a lot of other people that have spoken out that I think that have, really provided a lot of encouragement for others to speak out, and I think that's been, just fantastic for the whole kind of movement. So I do think that we do need more physicians speaking out, but that number is slowly growing. And hopefully, with more conversations like this, we'll have even more people coming out as well. And the other thing that why more people are speaking out now too is because of the studies. Like we talked about the mass study or the Cochrane review. We talked about the Lancet study, and then also too, I'm not sure if you saw, I forget the journal, but there was a meta-analysis plus sequential analysis on vitamin D, and they literally said in the conclusions that there is indisputable evidence for vitamin D against COVID. And there was also multiple other meta-analysis that said the exact same thing. And there was another new study, I haven't put it on my Twitter yet. We're going to do it, I think, today or tomorrow, about vitamin D, preventing severe disease and infection. And so, all these things that so many physicians have been saying from the start are now, finally, not, I shouldn't say finally, they were shown to be true in earlier studies, but now there's just, more and more studies that are just validifying it. And so, is that something that you thought should have been discussed more? Because to me, it was obvious that, vitamin D was just low hanging fruit. And I always say this too, like, even if I'm wrong, you should, have sufficient levels of vitamin D anyway, regardless of COVID or not, because, low vitamin D is linked to low testosterone. Low vitamin D is, linked to depression, so low vitamin D is obviously linked to osteoporosis. So, were you kind of surprised that we didn't, advocate for vitamin D earlier on?
I was, and I wasn't, because I know that our whole collective mindset in mainstream culture is never to address root causes, of which metabolic health is obviously the elephant in the room. And metabolic health ties into vitamin D. You need vitamin D for optimal metabolic and immune health. It's such a vital vitamin. So instead, what do? We lock people down. We take them out of the sunlight. Even worse for darker skin complexions like myself, who already millions. I know you've got a large Indian population in Canada too. It's a huge problem, lack of vitamin D in a colder climate. And it was such an easy thing that you could push and say, check your vitamin D levels, take a supplement, make sure that your health is optimized. Why not start with that, the simple things? And we could probably talk for an hour about avoiding ultra processed foods and everything else, sugar. I mean, instead of taking nurses' donuts, take them vitamin D capsules or some blueberries. But we just don't think it through, because we're all about band-aids in healthcare. And again, this is a whole other discussion, but we never get to root causes and think, who's getting sick? Why are they getting sick? I treated hundreds of COVID-19 patients. I had maybe 30 or 40 under the age of 50, and every single one was obese. I did not see a normal weight person come into the hospital with COVID-19 who was younger. And it's right then. We all saw that from the beginning. How many times did you see it talked about on the news? Hardly ever. I mean, it was such a golden opportunity. And if we didn't promote the metabolic health, anti-obesity message during COVID, when are we going to do it? That was the chance to do it.
Yeah, that was absolutely the chance. And I agree with you, 100%. If you look at all the data, it appears that obesity is a significant risk factor for, getting severe disease from COVID. And I don't know why that messaging wasn't sent out. And the other thing too, is that I understand, people say, okay, well, it's an infection, it comes on quick. You can't lose weight overnight. Fine. But you can lose weight in, 3 months. You can definitely lose weight in 6 months. You can definitely lose weight in 3 years, and it's been 3 years, and that messaging, is still not come out. And again, I'll come back to vitamin D on this. Like, you should be trying to getting lean anyway. You don't want to be obese for, so many different reasons, just like you want, optimal vitamin D for so many different reasons. So even if there was no COVID around, you should still obviously be trying to get to, a decent weight where you're not putting yourself at risk for, severe disease. And, I think, and I had Kevin Bass on here recently, maybe about a month ago, and he said the exact same thing. And he's been saying, the same thing on Twitter as well, is that this was a golden opportunity to really combat the obesity epidemic. And we failed miserably. And not only did we fail miserably, we didn't even address it. Like, it wasn't even a thought. And it's just atrocious that, this has happened, and that there was basically, very, very little news coverage on it.
Atrocious is a good word. Actually, we made it worse.
Yeah,
It
no,
wasn't
we
even
did. We
that we
did make
didn't
it
address
worse.
it. We actively made it worse, which is even more terrifying. Can I ask you, Dr. Hart, what vitamin D level you advocate for?
So in Canada, we use a scale that goes from 75 to 250 millimoles. I know a lot of people are using the nanograms per deciliter. So I always, test my patients, and I try to get them into the optimal range. So again, between 75 and 250 is the range in Canada. And I always make sure that, at least don't be deficient or
Efficient, yeah.
insufficient, because you definitely want to be in the normal range. Now, I'm not sure if you're at like, 250 or 225, if that's better than someone who's at, 125 or 150. I don't know if there's, as clear as data on that, but my guess would kind of just be that, generally speaking, with anything, like when you correct the most deficiencies, you're going to have the biggest return. So, if you take someone from deficient to insufficient, that's going to be massive. If you take someone from, insufficient to sufficient, that's going to be a massive increase or a protective effect. I don't know if there's a massive increase in protective effect from, say, being, lowly sufficient, whereas as to being, optimized. But, my kind of thing is like, why not be optimized? If you're still within a safe range, if you're still, not supplementing too much vitamin D, where you're not placing yourself at, risk for hypercalcemia or kidney stones or anything like that, then, I think it should be more geared towards, at least the middle range to the higher end range of vitamin D. But how about yourself?
Yeah, so we have a lot of debate. We obviously use a different scale. And
Yeah.
I think the lower cutoff is 20 to 25. So I like it above 30. I have seen some people taking monstrous doses of vitamin D, and it ends up close to 100. I've also seen studies, as I'm sure you have, that you don't want it to be super therapeutic because you can actually increase calcium buildup potentially. But most patients that I encounter, unless they're on a supplement, surprisingly low to deficient. So I get them on a oral supplement. The darker one's skin, the more likely, more higher doses that would be required. But yeah, 30 and above would be an ideal for me.
And do you recommend K2 as well? Vitamin K2?
I've seen that done. Typically, I'm not doing that routinely right now. Is that something you're a big believer in?
I mean, I'm not necessarily a big believer. I'm not necessarily saying that everyone has to supplement with vitamin K2. Some of the data does look pretty interesting. And for people who are listening, basically what some of the data suggests is that if you have sufficient or optimal levels of K2, what it's going to do is take that calcium and deposit it in your bones. Whereas if you don't have sufficient levels of K2, then it can be deposited into your arteries and contribute to coronary artery disease. So, I think I get a little bit of or quite a bit of K2, I think, from green leafy vegetables. So I eat quite a few of those. So I think I get enough from food alone. But if you're someone who doesn't eat too many green leafy vegetables, you don't get a lot of K2 in your diet, and it's not in, a ton of foods, then I think it's something that's reasonable to supplement with. And I have seen a lot more combination products of vitamin D3 with K2 recently. So it's something that I'm going to look into more into the future, because the research does look very interesting and promising on it.
Interesting. Yeah, I'm keen to look that up too. I mean, yeah, low hanging fruit there, vitamin D supplement. Some other elements that I would like to see research look into, which are crucial. I think a lot of people run at chronically low potassium and magnesium levels, magnesium
Hmm.
especially. I would
Yeah,
love to see
I
a
agree.
study on that. The amount of patients that I check magnesium levels on and they're low, and that is such a crucial cofactor. It's an element that everyone needs, trace element, and yeah, a lot of people are not getting enough, primarily because they don't have a good diet. But it's very easy to take a 200 or 400 milligram supplement of magnesium.
And do you always test on blood test magnesium RBC, or did
The
you
mag,
just do or did you just do a plain magnesium
a
level?
plain magnesium,
Plain
plain
magnesium. Okay.
magnesium. Yeah.
Okay. Interesting. Well, I know we only have a few minutes left there. Is there anything else that you wanted to discuss today?
Well, the whole focus on metabolic health and trying to get more awareness, I really hope that we are reaching a critical mass, because we are way worse than Canada and many other Western countries. It's been estimated under 10% of the country is metabolically healthy. I actually believe
That's in the
that we're
UK
the US.
or the US? Okay.
United
Sorry, go
States. The
ahead.
UK
Yeah.
is a little bit better, although not a lot better. And I really think that we are in a position where if you were to take the average American, say age 25 or 30, and the average sub Saharan African, 25 to 30, providing they're not in some extreme war torn area, the African would have better metabolic health than the American. And this
That's
is
crazy.
ultimately, it's going to bring down the country. Seriously, Mike, it is going to bring down the United States. I mean, you cannot have so many people so sick. I mean, our metabolic health is being destroyed. We've already touched on some reasons why: ultra processed foods, sugars, seed oils, unnatural foods. And I do believe that we need a campaign on the scale of big tobacco to combat this. I'm not a big believer in big government or government overreach, but I don't see any other way than for government to get involved and say, look, this is destroying the country. Our competitors, Russia, China, etc., are much healthier than us. And it's crippling the country, increasing tax dollars. People get sick, they're not as productive. But we are in a horrible place in the United States, and it's visibly got worse. And it's not just a visual thing, people being obese. When I see it, I think of their metabolic health,
Mental
and we
health
have
too.
inflammation, mental
Yeah.
health, inflammation, and our country cannot continue down this road. The UK is not too far behind, but I'm keen to get your thoughts as well on how we even start to grapple with this issue and reverse the ship with so many people being sick right now from lifestyle related diseases.
Yeah, I mean, I was shocked when I heard it was about a month ago, maybe or maybe it was longer than that, actually, a few months ago. I had heard that the obesity rate in the United States is 42.5%. So I'm talking about obesity. The overweight category, it's about 70%. And it just keeps going up. So like my kind of whole thing is like, people say like sick care versus health care, and I get that. But at the same time, like if if what if it's 50% or 60% or 70% of people are obese? Like there's no healthcare system that's equipped to keep up with that. Like
Exactly.
I understand, preventative medicine. I love preventive medicine. It's my favorite thing. It's my favorite passion. But at the same time, we have hospitals which are supposed to be more, acute medical centers that you go to when you're sick. But we didn't create hospitals so that people uh could just basically treat themselves very, very poorly, put on all this weight and then overwhelm hospitals. Like hospitals were created so that if you got sick, you got acutely sick, you got into a car accident or something happened, you go to the hospital. But now hospitals are just being completely overrun by people with chronic diseases as opposed to people with acute diseases. And I think that's made the healthcare much, much worse. And it's created a huge bottleneck. A lot of people are finding it very frustrating in Canada anyways to, go to the hospital and not being able to get adequate medical care in a reasonable amount of time. And again, like I only see this getting worse. And again, the issue with this is that people are afraid to talk about it. You talk anything about, you mention the word obesity, and all of a sudden you're fat shaming. And it's like, guys, like
It's
we need to
ridiculous.
get this, we need
Yeah.
to get this thing under control. Like this is really, really bad. Like, if you have a problem, and you just sweep it under the rug, what's going to happen? That problem is going to get a lot worse. So, it might be a little bit ugly to talk about at first, but it's going to be a lot uglier if we don't, fix this issue. And I know that we agree on a ton of things, and I'd love to have you back on the podcast, just to talk about obesity and lifestyle medicine, and not to talk about COVID at all.
Sure. Yeah. Happy to do that. My area of interest. And yeah, we need to get away with this whole notion of fat shaming. I mean, we have to talk about it. It's our duty as physicians. And you've probably seen we have this ridiculous movement in the United States to normalize obesity, in some cases, even celebrate it.
Yeah,
And it's nothing could be worse than overseeing your
it's not
citizen
working.
get sick and saying nothing. And the very people who claim to care as well about minorities are watching them get sicker and sicker, and then they eat up healthcare costs and go bankrupt themselves in the end in the United States. It makes no sense. We have to talk about this. To hell with all these people who say you shouldn't weigh people at the doctor's office or talk about it. We have to, even if, I mean, we call it fat shaming, but was the world really worse 30, 40 years ago? People would pile on pounds, everyone would say what's going on, and then they'd say, oh, okay, I'll cut back.
Yeah.
But in today's environment, we do have a lot of other reasons why people's metabolic system is completely thrown off. It starts with the food supply. It's going to take some sort of government intervention, I believe, at this stage to reverse this. But as you said, whole other topic. I would love to come back and talk about just that with you.
Okay, perfect. Well, I think part one is kind of over, so we'll end it there. But Dr. Dhand, tell everyone where they can find you online, about your Twitter handle, and where they can learn more about you.
Yeah, so I have a website, suneeldhand.com, where you can learn a lot more about me. I am on social media, Twitter at Dr. Suneel Dhand. I also have a YouTube channel and put out regular videos, an uncensored platform, which we need nowadays on locals. And I also run an online course, which focuses on metabolic health. You can find all of these things via my website and Twitter. So come find me, and hopefully, if you've enjoyed what I've said and what we talked about, I can help you some more.
Excellent, excellent. Well, again, thanks so much for coming on, and I'm holding you to it. We're good. Definitely going to have to do round two soon.
Definitely. Take care. Thank you for having me.
Okay, thanks for listening, everybody. And as always, I'll be back again next week.